Stacey Abrams spending time at the Curtis V. Cooper Health Clinic, saying the care provided here for low income is something needed in many parts of Georgia.
Healthcare is about not only the physical health, it's about the economic health of our state. It's about how we create and retain jobs.
She began with mental health and a personal story.
I've told many people the story of my brother Walter. And Walter wandered for years in and out of rehab treatment centers. But it wasn't until he was imprisoned for the first time in 2014 that he was diagnosed as bipolar. And the reality is Walter's story is not new. Across the state of Georgia, the #1 provider of mental health services is our prison system.
Abrams wants Georgia to do better by those who need treatment, not incarceration, and says in general there is a need for more social workers, for example.
Because Georgia does not have enough mental health professionals in our state, and as the next governor, I will solve that problem. And this will also make our schools safer. We know that mental health care is directly linked to violence.
Abrams favors expanding Medicaid and says helping many in Georgia who rely on the Affordable Care Act is more important than ever.
Because everyone understands that if we lose the Affordable Care Act, pre-existing conditions go back on the chopping block. And unfortunately, I have an opponent in this race who has voted to do that before. I will be the governor who protects access to health care in the state of Georgia, not simply by defending the Affordable Care Act, but by expanding Medicaid.
Joanne Merrigan, WSAV News 3.